There was a man, 67 years old, who woke up one morning feeling perfectly normal. No chest tightness, no dizziness, no sign that anything was wrong. He felt rested, he felt like himself, so he did what he always did. He got up, walked to the bathroom, turned the shower handle to cold, and stepped right in. He had read somewhere that cold showers were good for your health. 20 minutes later, his wife was on the phone with emergency services. I was the doctor called in that morning. I performed the surgery. He survived. But I have stood in operating rooms after cases just like his that did not end the same way. What happened to that man was not random. It was not simply bad luck. It was the result of a specific chain of events. Events that repeat themselves in homes all across America every single morning, in people who feel completely fine and have no idea what is happening inside their bodies. Today, I am going to walk you through exactly what that chain looks like, why it targets people over 60 more than anyone else, and what you can do starting tomorrow morning to stop it. Let me start with something that surprises most of my patients the first time I tell them. The hours between 6 and 10 in the morning are statistically the most dangerous window of the day for your heart. Research published in the American Heart Journal shows the risk of a cardiac event is roughly 40% higher during those 4 hours than at any other time. That is not a minor variation. That is a significant and well-documented pattern. Cardiologists have a name for it. We call it the morning surge. And if you are over 60, that surge is harder, faster, and less forgiving than it was 2 decades ago. Here is what is actually happening inside your body during those hours. While you sleep, your entire system slows down. Heart rate drops, blood pressure lowers, your nervous system settles into a quiet, steady rhythm. But the moment your body begins moving toward wakefulness, even before your eyes open, everything shifts. Cortisol and adrenaline begin climbing. Your heart rate picks up. Blood pressure starts rising. Blood vessels begin to constrict. All of this happens at once, within minutes, sometimes within seconds. It is like turning the ignition on a car engine that has been sitting in a freezing garage all night and immediately flooring the accelerator. The engine is not ready. The systems have not had time to warm up, but full demand is already being placed on them. When you are younger, your cardiovascular system absorbs that kind of shock without difficulty. The vessel walls are flexible. The heart is strong. The whole system adapts quickly. After 60, the picture is different. Vessel walls become stiffer. The heart takes longer to shift gears. And in many people, there is plaque built up inside the arteries. Plaque they are completely unaware of because they feel fine. When that hormonal wave crashes into an artery carrying a vulnerable plaque deposit, the pressure can fracture it. A fractured plaque triggers the body's clotting response. A clot in a coronary artery is a heart attack. That is not a worst-case scenario. That is the mechanism I see described in pathology reports. That is what I have witnessed firsthand. What makes this window even more dangerous is something most people never think about: the state of their blood the moment they wake up. After 7 or 8 hours of sleep, your body has been losing moisture continuously through breathing. You have not had a single drop of fluid all night. The result is that your blood is measurably thicker in the morning than it was when you went to sleep. Thicker blood means your heart has to push harder to move it. It also means clotting factors are more active. Studies have confirmed that clotting activity is at its peak in the early morning hours. This is not coincidence, it is biology. The hormonal surge, the thickened blood, and the stiffened vessels all arrive at the same time. That combination, hitting a heart that is already over 60, is what drives the clustering of heart attacks and strokes in that early morning window. The solution to this particular problem is almost too simple. A glass of water at room temperature, before anything else. Before your coffee, before your phone, before your medication. One glass, it begins diluting the blood, reducing clot risk, and giving your cardiovascular system a small but meaningful advantage before the day even starts. This is one of the highest impact, lowest effort habits in cardiovascular health, and the majority of people skip it every single morning. Now let me talk about the cold shower, because this is the detail that hits closest to home for the man I operated on. Cold exposure has genuine health benefits. I will not pretend otherwise. But there is a specific reason why stepping into a cold shower first thing in the morning is a significant cardiac risk for anyone over 60, and it has to do with timing. The moment cold water contacts your skin, your body activates what is called the cold shock response. Blood vessels near the skin surface constrict rapidly to protect your internal temperature. Heart rate spikes. Blood pressure surges, sometimes by 20 to 30 points in a matter of seconds. Under normal circumstances, that is a meaningful cardiovascular jolt. But in the morning, your pressure is already elevated from the hormonal surge. Your blood is already thicker than usual, and now you are layering a sudden vascular constriction on top of all of that. For someone with even moderate arterial stiffness, that combination can be the trigger. It can fracture a plaque. It can provoke a coronary spasm. It can destabilize the heart's electrical rhythm. That is what happened to the man I told you about. His arteries were not in terrible shape, but they were not perfect either. The morning surge combined with the cold shock was simply more than the system could absorb. The recommendation is straightforward. Begin with warm water, around body temperature. Let your vessels dilate and your pressure stabilize before introducing any cold. If you want the benefits of cold exposure, save it for the final 30 seconds of your shower. By that point, the most dangerous window has passed, and your body is far better equipped to handle the transition. The way most people get out of bed is also worth addressing. The typical morning looks like this. Alarm sounds, person swings their legs over the side, stands up immediately, and starts moving. It takes about 2 seconds from lying flat to fully upright. The problem is physiological. When you are lying down, your blood is distributed relatively evenly throughout your body. The moment you stand up, gravity pulls a significant volume of that blood downward into the lower half of your body. Your cardiovascular system has to respond quickly to compensate, raising heart rate, adjusting pressure to maintain adequate blood flow to the brain. In a younger person, that compensation happens almost instantly. In someone over 60, it takes longer. Some people experience a brief drop in blood pressure, feel lightheaded, or notice their heart working harder than it should. Some do not notice anything at all, which does not mean nothing is happening. A slower, more deliberate transition from lying down to standing gives your system the time it needs to make that adjustment safely. There is one more area I want to cover because it affects far more people than realize it, and it sits at an intersection most people do not know exists. Many older adults take diuretic medications, water pills for blood pressure management or heart conditions. These medications are effective and commonly prescribed, but one of their known effects is that they flush magnesium out of the body along with excess fluid. Magnesium is not a minor nutrient when it comes to cardiac function. It plays a direct role in regulating the electrical signals that control the heartbeat. It helps maintain a steady, consistent rhythm. It allows the heart muscle to relax properly between contractions. When magnesium levels fall, even quietly and without obvious symptoms, the heart becomes electrically unstable. Palpitations, skip beats, and more serious arrhythmias can develop, and the morning when cardiac stress is already at its daily peak is precisely when that instability is most likely to surface. I have treated patients whose morning arrhythmias completely disappeared after we identified and corrected a magnesium deficiency. If you are on a diuretic, ask your doctor to check your magnesium level at your next visit. It is a standard blood test. It takes minutes. The information it gives you could be genuinely important. The last thing I want to address is morning exercise, because this is where good intentions and bad timing can collide. Exercise is one of the most powerful things you can do for your heart. That is not in question. But the first minutes of the morning are not the right time to push intensity. Cortisol is elevated. Blood pressure is up. Blood is thicker. The coronary arteries are slightly constricted. Launching directly into vigorous exercise in that state places extraordinary demand on a cardiovascular system that is already managing a heavy baseline load. Research published in Circulation found that intense physical exertion in the early morning carries a meaningfully higher cardiac risk in adults over 60 compared to later in the day. This does not mean avoid morning exercise. It means give your body 20 to 30 minutes to wake up, hydrate, and stabilize before you increase intensity. Start slow. Let the system warm up properly. The workout will be better for it, and so will your heart. So here is what I want you to do. A 5-minute sequence every morning that costs nothing and requires nothing except the intention to do it. The moment your alarm sounds, do not move. Stay where you are and take 3 slow breaths, in through the nose, out through the mouth. This activates the calming side of your nervous system and helps blunt the cortisol spike before it peaks. Then, before your feet touch the floor, drink the glass of water you placed on your nightstand the night before. The whole glass, room temperature. Then roll to your side, push yourself up, and sit on the edge of the bed. Do not stand yet. Rotate your ankles in slow circles, 5 times in each direction. This activates the calf muscles, which act as a secondary pump pushing blood back up toward your heart. While still seated, gently roll your neck, shrug your shoulders, stretch your arms overhead. You are waking up your muscles gradually, increasing circulation at a pace your heart can comfortably manage. Then stand slowly, at about half your usual speed. Plant both feet flat on the floor. Pause for 10 seconds before taking your first step, and let your blood pressure settle into its new position before you start moving through your morning. 5 minutes. That is the entire sequence. It is not complicated. But on the days when you do it, your heart enters the most dangerous window of the day with preparation, not exposure. I want to close with something I think about often after more than 15 years in cardiac surgery. The cases that stay with me are not the most complex ones, they are the preventable ones. The retired teacher who had a cardiac event getting out of bed on a Wednesday morning. The grandfather who stepped into a cold shower and never came back out. These were not people who were obviously sick. They were people who simply did not have the information I am sharing with you right now. The morning danger zone is real. The research behind it is solid. But it is also one of the most manageable risk factors in all of cardiovascular medicine, because your morning routine is something you can change today, before tomorrow's alarm goes off. You do not need a procedure. You do not need a new medication. You need 5 minutes and the knowledge of what your body is doing while you sleep. The man I told you about at the beginning came back to see me 3 months after his surgery. He looked healthy. He looked like himself. The first thing he said to me was, "Why did nobody tell me this before?" That question has stayed with me. It is a large part of the reason I do this. Now you know, your heart has been working for you every single minute of every single day without asking for anything. 5 careful minutes in the morning is not a sacrifice. It is the least you can give back. And it starts tomorrow. As always, everything I have shared here is grounded in published research and my own clinical experience, but your situation is specific to you. Before changing your medications, your exercise habits, or your morning routine, speak with your own doctor first. This is information to guide a conversation, not to replace one. I am Dr. Shoaib. Stay informed, stay consistent, and I will see you in the next one.